Session 5, this is looking at managing pain. If we look at the way that the majority of people tend to manage their pain, it can be broadly divided into two different types of strategies. The first strategy that we're going to look at is what we would refer to as avoidance coping. And this is where we tend to fall into a pattern of becoming quite fearful of our pain. We tend to avoid doing certain activities. We become fearful of doing certain activities because we've learned that doing those activities can end up triggering that pain. This can then lead us to start to avoid things that we enjoy. It can avoid doing things that we like doing, that kind of give us value. And that can then lead to becoming more and more withdrawn. It can lead to effects on our mood. And we stop kind of trusting our body to be able to do things and feeling that we need to protect it. The other way that people tend to kind of fall into managing their pain is what we call persistence coping. And this is where we kind of tend to do the opposite. People sort of try to ignore their pain, pretend it isn't there, and sort of grit their teeth and push through it. They may feel that they have no other option, things need to get done, and we try and push the pain to the background and carry on despite it. This sort of takes what we would encourage in terms of trying to keep active, but it takes it to a kind of far more extreme kind of version. So we take something that's good in terms of keeping active, but we end up overdoing it and often causing a flare-up as a result. What we are trying to look at is trying to find a middle ground, trying to find a balance between these two strategies. The analogy that I find is sort of useful for explaining this is to imagine your pain is like a sleeping bear. Get to the point where we are comfortable sort of nudging around the edges and exploring our pain. We can prod it, we can get sort of up close to it and get sort of comfortable being there. And we can maybe kind of cause that pain to stir a little bit, as long as we then sort of back off and let it sort of settle back down and go back to sleep again. But what we don't want to do is go up and whack it and cause our pain to have this big kind of flare up and big increase. One of the methods that we encourage people to look at is what we call it graded exposure. So this is taking your activities that you want to get back to doing. So for example, it might be going for a walk and finding where your baseline is, for finding the distance that you could manage, where you know that when you get home, things feel relatively comfortable. And then over time, we might start to try and increase that a little bit. So we find where the edge of that discomfort starts to become. Where does our pain start to come on? What happens if we kind of push to the edge of that discomfort slightly? Does that settle down quite quickly? Does it stay aggravated for a period of time? And how long does that take to settle? If it feels okay, if it settles down quite quickly, we might repeat that and we might go up to that edge of that discomfort again. And we might again explore how we feel, how that makes us feel when we're in that discomfort. And we then back off again and we let things settle down. And over time, by prodding into that discomfort instead of trying to ignore that pain, we might find that we can gradually then extend the period of time that we are at that edge of discomfort for. We can also use other methods to try and help with this. So we can look at techniques like modifying that activity. So it might be that we change the environment that we're in when we go for that walk. So it might be that if we're trying to do it in one location, we change that location. So we might choose to do it in a gym on a treadmill, for instance, versus out where the terrain is maybe more uneven. It might be that actually we choose to do that close to home, so we reduce the fear of getting stuck in the middle of nowhere and not being able to get back. We might do it in an environment that we feel comfortable in. Or equally, we might look to change who we're with when we do it, since either doing it by ourselves, or we might choose to do it with a friend or a family member. We might change the time of day that we're trying to do it, if there's a particular time of day that things feel better. We might reduce the amount of time that we do it for initially. We might reduce the speed or the intensity initially, and trying to find a position where we are comfortable in. We might also use things like listening to music, or changing what we're sort of hearing, or what we're doing at that moment in time to find a way into it. And then we might find that we can gradually build up once we've found a comfortable way of doing it. Overall then, using some of the things that we've talked about, we want to think about different strategies, the way we're going to start to approach our pain. Education and understanding our pain are really, really important for us to try and look at how are we going to try and get back to doing some of the things that we want to get back to doing. Hopefully, understanding more about it might reduce some of that threat of what we're doing, and when we do get pain, hopefully reducing some of the fear and worry that we might get associated with that. Understanding that the pain doesn't necessarily always mean that we're doing damage can help, but equally being patient with this and not trying to kind of ignore the pain and push through it equally at the same time. We want to use all of the different tools that we've learned. So pacing, using goal setting, using relaxation, all of these things together to try and look at how we're going to get back to some of the activities that we want to get back to. Most importantly, it's looking at our lifestyle. It's looking at activities that we enjoy, that help promote those kind of release of those good chemicals around our body. And then thinking about how we're going to get back to doing things that we want to do. We want to remember the link between pain and mood, and understanding that link between the two, and looking at activities that are going to help with our mood. Thinking about our posture and our movement, but equally not getting too hung up on thinking about what is correct and what's not. More important to think about what positions are comfortable versus uncomfortable. And thinking about how we're going to be active in our rehabilitation rather than being passive. So taking control, thinking about activities and ways that you can do it rather than needing to rely on other people to do it for you. So, as one of the famous Australian researchers in the world of pain called David Butler would say, motion is lotion. It's about identifying what our core values are, what our goals are, and focusing on those as the sort of focal point of our progress. Finding our baseline, finding how we're going to then progress from that, being patient, trying to avoid flare-ups where possible, but equally accepting that they do happen from time to time, and having a plan in place of how you're going to manage those when they do occur. That's the end of the session. Any questions, we would encourage you to discuss those with your key therapist